All right, back with Dr. Aznavour. Dr. Aznavour, tell me, what's the difference between a veneer and a lumineer? People keep asking it. We non-dentists simply don't know.
Well, the main difference is if you want your tooth to be grinded or not. That's the difference. Lumineers are what's called the non-grinding veneer. It goes over your tooth, just like a veneer. The only difference is there's much less grinding that's happening on the tooth. And what's the advantage and disadvantage, for example, of a lumineer versus a veneer? Well, a lumineer, of course, the number one is you're not grinding too much tooth structure. You're grinding a very minimal amount, meaning you're just barely roughening the tooth up, and then you're putting porcelain fabricated over the tooth. You're bonding it on there. The disadvantage of the lumineer is that it tends to be bulkier than a veneer. If you don't reduce a tooth, it's just like having nails, you know. If you put something over your nail, it's going to look more rounded if you don't remove something. So for example, a lumineer, if you don't remove anything, you're going to put porcelain over the tooth. So it's going to look a little more bulky than what a veneer would look like. A veneer, you do have to do some grinding on the facial surface of the tooth, and that makes it less bulky, and that will make the tooth look more flat and give it a more natural appearance. That's the difference between a lumineer and a veneer. Do you want your tooth to be ground down or not? Which one do you want to make your teeth look bulky or not? So it's something that's a personal choice. Some people don't mind having their teeth ground down, and some people have very flat teeth and they don't mind having a lumineer because it can restore some shape to their tooth. Now the disadvantage of both lumineer and veneer is that you have to be careful what you bite into because they can always break off. So you have to make sure you are not a person who grinds their teeth. You have to have the doctor do a proper evaluation of your bite prior to placing the restoration, because these are restorations that can fail because of bite issues or hygiene issues. So you have to be very careful based on your treatment plan.
I see. So if a person would be grinding a teeth, either one of those options wouldn't be very good. And what should a person then do if that happens? What would be the other choice?
The other choice would either be to crown the teeth, because a crown would be full coverage. Now, veneers and lumineers, they stay on the tooth by bonding. And bonding is very good. The only issue is, like I said, to grinding, you can flick it right off. With a crown, the difference is, we're getting into physics here, but it's a mechanical retention. That means that the crown isn't held on with the glue. It stays on there because of the shape of the tooth. So that's the advantage of putting a crown, which will also last much longer, although sometimes cosmetically will not look as nice.
I see. All right. So, and in terms of so if a person, since a tooth becomes more bulky, so if a person has only one tooth missing in front, would only doing one lumineer would probably not be the ideal thing, because that one tooth would be more bulky than the other one. It wouldn't. It might be looking like a piece of rock on a beach or something like that, right?
Right. So, for example, if one tooth is further, you don't like the shape of one tooth, yeah, you can do a lumineer on that tooth, but first of all, the shape may look different, it may look more bulky, and not only that, but the shade, the color will not match as perfectly compared to if you're doing, let's say, 4 front teeth so they match, or even 6. So that's one of the disadvantages of doing one restoration over 6, let's say, 6 front teeth.
Right. So a veneer is a little bit easier to adjust if you just want to do one, because after all, cost is always a matter of, it's always a question. So is a lumineer in that case usually slightly better in order to adjust it to the other teeth?
Yes, a lumineer is in a way better, but I wouldn't say, I would, preference-wise, a veneer would be the best choice versus a lumineer.
That's what I meant, actually. That's what I meant. I mean, if there's only one tooth to do a veneer would be actually then a better choice to do only one, if that's what the person financially only can and want to do.
Yes, that's because you could shape the tooth according to the alignment of the other teeth, and then the lab will properly be able to make the porcelain veneer, whereas a lumineer, the lab technician could only work with so much.
Got it. Well, thanks for telling us. For more information on veneers, on lumineers, on crowns, and on all kinds of dentistry, go ahead and visit Dr. Aznavour's website shown below, or call him on the phone number directly, and get there. It's important. Bye-bye.